Dear students, today we are going to talk about ECG. My topic is depolarization and repolarization of a myocardial cell. As all of you know that a resting myocardial cell maintains the potential difference of minus 90 millivolt. Outside of the cell is always positive and inside of the cell is always negative. This polarized cell maintains the potential difference of minus 90 millivolt. This is known as resting membrane potential. Now, the resting membrane potential of a myocardial cell is minus 90 millivolts. As all of you know, in a normal environment in the physiology, outside of the cell is rich in sodium and inside of the cell is rich in potassium. When the cell is stimulated by the impulse coming from the AC node, some sodium channel open and the sodium from outside of the cell enters the cell. As all of you know that inside of the cell was negative and some positive ions are entering. Naturally, the negativity inside of the cell becomes less negative. It will become minus 80 millivolts, minus 70 millivolts. Now, as some sodium is entering the cell and electronegativity of the cell is reducing, it will come down to minus 70. Minus 70 is known as threshold potential of a myocardial cell. What is the threshold potential? Threshold potential is a potential at which many voltage gated sodium channel open at a time. And suddenly, much sodium enters the cell. As much sodium is entering the cell, the electronegativity reduces to minus 60, minus 50, minus 40, minus 30, minus 20, minus 10, 0 and go to plus 10. When the electronegativity of a cell changes to electropositivity, outside of the cell become negative and inside of the cell become positive. As now inside of the cell is positive, the potassium ion which is rich inside the cell starts going out. And this electronegativity which is plus 10 now comes to 0. As some potassium from the cell is going out. The electropositivity, that is plus 10, now reduces to 0, and at the time when it comes to 0, some calcium ions start coming inside. Calcium ion from outside coming inside, which is a positive ion. Some potassium which is rich inside the cell is going out. Now one positive ion potassium is going out, one calcium ion positive is coming in. For some period, electrically the cell becomes neutral. That is, a plateau phase will develop. Some potassium is going out and calcium is coming in. They are balancing each other. But after some time, the calcium channel closes and only potassium is going out. Now, as the potassium is a positive ion and is going out from the cell, naturally the electronegativity of the cell will increase. Now it will become minus 10, minus 20, minus 30, and this process will stop at a point where it will again come down to minus 90 millivolts. Now we have started from sodium. Beginning with minus 90 volt, come to minus 70 millivolts. Minus 70 millivolt is a threshold potential, whereas many sodium channel open at a time and electronegativity of the cell becomes electropositive plus 10. Then after that, the potassium from inside the cell start going out. It will come to minus plus 10 comes to 0. At the 0, some potassium was going out and some calcium was coming in. Both are positive, balancing each other. Therefore, for electrically the cell will be neutral. This is known as a plateau phase. After some time, the entry of calcium inside the cell stops and only potassium was going out. And from that 0, it will come down to minus 90. 0 to minus 90 is an event related with potassium, and that potassium is related with repolarization of the cell. Sodium, when the cell was electrically negative, becomes electrically positive. This is depolarization of the cell. Depolarization of the cell is a sodium dependent event. Repolarization of the cell is a potassium dependent event. And a plateau phase is maintained by outgoing of potassium and incoming of calcium. You can say that the calcium ion is responsible for the plateau phase. Lastly, depolarization is sodium dependent, repolarization is potassium dependent, plateau phase is calcium dependent. Now, why it is important? It is important because if there is any problem in the ECG related with the repolarization, there is problem with the potassium ions. If there is problem in the ECG related with the sodium, it will be seen in depolarization phase. The use of antiarrhythmic medicine depends upon the same concept. And that is why depolarization, which is sodium dependent, repolarization, which is potassium dependent, is very important to understand. Because pharmacotherapy of arrhythmia especially depends upon these basic concepts. Thank you.